morning, Fort Wayne. I'm Katie Kincaid with the Indiana Youth Institute, and I greatly appreciate your patience with us today. So I'm here today, and I'm excited to be here today elevating the importance of kids in this conversation about the state of our health and the state of our well-being. And kids, we know, are critically important because we all benefit when our next generation is healthy, when they're safe, well-educated, and economically secure. And health is truly foundational for childhood well-being. These other areas, education, economy, they can't happen if our kids and our state aren't healthy. And in many cases, health challenges affect the entire family. When parents struggle with health challenges, the entire family, and especially kids in those families, are directly affected. And much of the goal of today, and especially now, is to spark discussions, conversations that leads us towards taking actions and making progress for these indicators. So Indiana has the 15th largest child population in the United States, with a child population of 1.5 million. These kids, a third, are living in single-parent homes. And our kids are growing increasingly diverse. About a quarter of kids in Indiana identify as a race or ethnicity other than white. 10% of kids are multilingual, speaking a language other than English at home. And 12% of kids in Indiana live in immigrant families. So our kids are growing increasingly diverse. And when we look at our national rankings, we have these important ones up here. We also have our national rankings in terms of childhood well-being. And when we look at all of those, we see that nationally we excel in a few areas, but we definitely lag in most and need to improve in all. So we look at our rankings for different areas of childhood well-being. Indiana ranks 28th overall for childhood well-being, right in the middle of the pack, but our lowest ranking is that in health, where we rank 35th. To give you an idea, these are our indicators that go into that health ranking for childhood health: low birth weight babies, children without health insurance, child and teen deaths, and youth substance abuse. And when we break out our national rankings even further and look at specific indicators, on the left over here, you'll see the highest 5 indicators. There's a theme. They tend to be in the area of education and economy. Our lowest 5 indicators, the areas where we do worst, are in health and safety. We see 42nd for infant mortality, 37th for child and teen deaths. And with all of this data, a clear theme emerges that in all areas of childhood well-being, and especially in health, that there are clear disproportionate challenges and barriers that exist for kids by race, place, income, and immigrant status. And today we focus on 4 critical issues impacting Hoosier kids, though we know there are many. Infant mortality, smoking, opioids, and obesity are all directly affecting our Hoosier kids. And part of what's great about today and being here together is that we can all be part of the solution. Individuals, organizations, communities, leaders, and policymakers are all part of this solution. So infant mortality has been something highlighted in our state. We heard it from speakers earlier. Our governor, in his State of the State address, set the goal for Indiana to become the best state in the Midwest for infant mortality by 2024. A goal well needed, given that Indiana infants are 24% more likely to die before their first birthday than their peers nationally. This is not a new trend. Indiana has lagged behind the national average for the past 2 decades, with infant mortality being a persistent issue for our state. And when we dive deeper into this data and look not just at infants overall, but look at that disaggregation by race, we see that this really is an equity issue. In Indiana, Black infants are more than 2 times as likely to die before their first birthday compared to their white peers. And we see similar disparities and disproportionate challenges in those risk factors as well, that Black infants are significantly more likely to be born preterm or with low birth weight than their white and Hispanic peers. Addressing infant mortality is tough, But there are things that we can do as individuals, organizations, communities, leaders, and policymakers. And so we break out our solutions by these roles. Individuals can take small steps to provide support, encouragement, and assistance to mothers attempting to quit smoking or get access to prenatal care. Organizations and communities can take a lifespan approach to women's health, which we know can affect birth outcomes. And leaders and policymakers have a critical role in expanding access to care and maintaining the important focus on equity. So smoking, we've heard a little bit about youth smoking and teen tobacco use, which we know affects kids' health, as does maternal smoking and exposure to smoke in the home. In Indiana, 13.5% of expectant mothers smoke during pregnancy, and that rate is significantly higher than our national rate. We also see a lot of variation across the state. There are different counties, certain areas that are more directly or heavily affected. Allen County is actually ranked in our 10 lowest counties for maternal smoking, with about 10% of mothers smoking during pregnancy. But those disparities persist. In Indiana, white mothers are significantly more likely to smoke during pregnancy than Black or Hispanic mothers, and those younger mothers, ages 18 to 24, are most likely to smoke during pregnancy. So the other aspect that really affects youth health is teen tobacco use, and the starting point for that is access to cigarettes and other tobacco products. 6 in 10 Indiana high school seniors say that it would be very easy to get access to cigarettes. 20% say it would be very hard. And 40% of high school students have ever tried cigarettes, almost half. And we know the most commonly used tobacco product is electronic vapor products. 15% of Indiana high school students used an electronic vapor product in the past month. This is something that has caught our attention, and somewhat surprisingly, that rate has actually fallen a little bit from the prior year, down from 19% in 2015, but it still remains the most commonly used product. Next, we see cigarettes, with 9% of Indiana high school students using cigarettes in the past month. And we know that teens who used e-cigarettes and electronic vapor products are significantly more likely to subsequently take up cigarette smoking. When we look at this longitudinally, cigarette smoking has actually fallen consistently over the past few years, from about 2011, 2012 to 2017. We've seen this fall consistently amongst all grade levels, from 9th to 12th grade. So smoking solutions, there are things we can all do, coordinated efforts to establish smoke-free social norms. Smoking cessation programs we know are critically important, and we can encourage in our communities and our environments tobacco-free environments and lifestyles. So Indiana's opioid epidemic is also critically important, with drug overdoses now killing more Hoosiers than car crashes and gun homicides combined. In 2016, we lost 1,500 lives to a drug overdose, a 59% increase over the past 5 years. And when we look at opioid overdose deaths specifically, that number has risen 126% over the past 5 years. This is a growing concern in our state. And it truly is a statewide issue. It's not confined to any one area. 88 of Indiana's 92 counties had at least 5 overdoses resulting in an ER visit. 89 of our 92 counties have experienced an opioid overdose death in the past 5 years. So the vast majority of our Indiana counties are directly affected. And clearly kids are affected by this epidemic. We see it earliest through prenatal exposure. We also see that parental substance abuse or parental opioid abuse interferes with parent-child relationships. It is associated with an increased risk for child maltreatment, especially child neglect. And in more cases, we're seeing that when a child is removed from their home by DCS, they're being removed because of parental substance abuse. As of 2013, parental substance abuse was the primary factor in a little more than 30% of cases. As of 2017, that rate's nearly doubled to almost 60% of cases, where parental substance abuse is the primary factor. So substance abuse and the opioid epidemic truly affects the entire family. And for individuals, there are small things we can all do in our own homes that I'm sure many of us are already doing. Things like properly disposing medication, being aware of what pain relievers your teenager might be prescribed. Organizations and communities have a critical role in implementing substance abuse prevention programs, which we know can truly happen in any setting. And leaders and policymakers have a critical role in ensuring the entire family is included in treatment and the entire family is included in policy. We clearly see that when a parent struggles with substance abuse, it's not just that parent who's affected. It's the entire family, and it's especially the kids. So we can ensure that those kids are included. We see obesity and the growing prevalence of obesity as a widespread issue for our kids. In Indiana, 1 in 3 children ages 10 to 17 are overweight or obese. 19% of our kids are obese, 15% overweight. And many of our kids are not getting the full range of physical activity that's recommended. So the CDC recommends an hour or more of physical activity each day. And amongst kids ages 6 to 11, 36% of kids are getting that physical activity each day. Among ages 12 to 17, 19% are getting that level of physical activity each day. And we also see this somewhat seemingly paradoxical relationship between food insecurity and obesity, where kids who have experiences with food insecurity are at a significantly greater risk for overweight and obesity. And in Indiana, 1 in 5 children are currently food insecure, meaning they don't have sufficient access to healthy foods at all times. And 63% of families say they could always afford to eat nutritious meals in the past year. Almost 40% say that they could not always afford to eat nutritious meals in the past year. And nutrition has an impact on overweight and obesity, but also day-to-day outcomes like healthy functioning and attention in school. So 3 in 10 Indiana high school students report eating breakfast every day. 7 in 10 are not eating breakfast consistently. And 2 in 10 Indiana high school students drink soda every day. So with all of this data, because there's a lot of information about this, the state of our health boils down to a few key points. That nationally, we excel in few, but we lag in most, and definitely need improvement in all. There are clear, disproportionate challenges and barriers that exist for our kids that deserve our attention and our focus on equity. And infant mortality, smoking, obesity, and our opioid epidemic are all critical issues that are directly affecting Hoosier kids. And for all of us, it's in all of our best interests to make sure that each and every child has the full support that they need to live a healthy life and reach their full potential. So we do have a bit of a call to action, some things to take away from today. Hope that you are able to communicate some of the key data and solutions. Hope that if you have access to data and services, that you promote that access and let people in. And then we also encourage creating collaborations to make a difference. Find someone that you met today or that you know and work together towards these outcomes. We truly know that it takes all of us working together. And then commit to learning more. Find an issue that you learned about today or another time that inspires you, lean into it, and commit to learning more about that particular issue. So I hope that you'll connect with the Indiana Youth Institute in your efforts to learn more, and thank you so much for the time today.